already know, aspiration. Pressure sores. Anything else?
Does bloody nose, dry airway, and congestion due to sinus issues?
Yeah, we can just put,
Humidification?
yeah. So, dry airway. Then the patient would need to have a heater. I'm gonna erase this part because I think everybody's good with this, right? Okay. So, what could we do to prevent pressure supports? Pressure supports. Pressure supports.
What?
Oh my gosh.
Size the mask.
So we can put padding. There's all different names for it. But any kind of padding that will help. Yeah, we have some here. There's gel. There's all different kinds of ways. So anything that keeps it from putting pressure on the skin. Jeremy?
I would say brace if they can stand it.
If they can tolerate it, usually the patient can't, which is part of the problem. But what about rotating masks? So there's nasal masks, and we'll get them out so you guys can see them, but there's nasal mask, there's a full face mask, there's a full face mask, the total face mask, there's little prongs. So literally every 2 hours you could use a different device. And because pressure sores, soon as you see red on your patient's skin, you guys, you should realize that that's put pressure on there. And the longer it stays there, the higher the likeliness of a pressure sore. These are, I say pressure support a billion times a day. These are the most high likely places for pressure sores. It's on the, I'm just gonna do it over and over again. So just get over it. Yeah, we can pass that. Pass this. So in here, right up here on the bridge of the nose, it's sometimes hard to get it to seal down here, especially if people have facial hair. But did you guys see the different types of masks last term?
Yeah.
Okay, good. I think Mr. C said that was one thing he did show you. Okay. So this is called, if your patient gets a pressure sore, it's called, so what we're looking for is the HAPU protocol, which is what's being put in place now. Hospital-acquired pressure ulcer. HAPU. Hospital-acquired pressure ulcer. There's protocols now in place. So some of it involves just nursing as far as rotating your patient. But we have BiPAPs that cause pressure sores. What else causes pressure sores? That's what we're talking about, the mask. But let's just talk about other pressure sores. We could get our ET tube, right? Trach, nasal cannula, and BiPAP masks. So we have our patients in treating them, we have a very high risk of giving them a pressure ulcer. The nasal cannulas cause them on the ears, ET tubes on the mouth, trachs on the neck, BiPAP on the face. So big deal now is to prevent that. So pay attention and see what your protocols are. If you see redness starting in any area, you need to do something to help prevent it. Get your nurse involved too. Okay, so settings. Where do we start?
It's like
10 over 5 or 12 over 6 or something like that. Most common starting place. How do you know if your patient's getting the appropriate tidal volume? Yeah, so how do we,
Ideal body weight.
what's the range? 5 to 8.
So I do have a question, because of, reading the book, they do have, 6 to 8 a lot in the book, not the 5 to 8.
Yeah, it's-
What's going to be on the test, will it be 5 to 8, or will it be a 6 to 8?
It's 5 to 8, but it's usually in general enough that you guys are gonna be able to figure it out without getting that particular.
Okay, I'm just wanting to make sure.
No, I know. We generally use 5 to 8.
Okay.
So remember, EPAP is for oxygenation, IPAP is for ventilation. So, if I'm on 10/5, then my pressure support is +5, right? You increase pressure support to blow off CO2. And increase ventilation. So, for a ventilation problem, you increase IPAP only, which is gonna increase your pressure support. So, if I went to 12/5, my pressure support would now be +7. Is everybody good with that? Jeremy?
The doctor's orders for in pressure support, or are they gonna give you an iPad each time?
Depends on the doctor.
Okay.
Sometimes they're gonna say BiPAP at 40%, pressure support is 6.
So if they give you
Sometimes
a
they're
pressure-
gonna say 12/6.
So if they give you a a pressure support number, can you adjust it as much as you want, or,
There's gonna be a protocol in place normally.
Uh-huh.
But if you have a pressure support order, you can't adjust it however you want because it's gonna change the pressure support when you change the numbers.
No, I mean, like, 'cause of course, you have to take the iPad with the EPAP to keep the pressure support the same kind of thing.